So our second speaker, we first got to know Dr. Carson, if we kind of remember back in 2020. Dr. Carson came to campus, and I have to say, and many of us who are faculty here will agree, probably the best talk that we have ever heard on the combination of faith and reason. As you'll hear from his background, that he was instrumental with a lot of what transpired with COVID. Dr. Carson is a physician who is board certified in the specialties of internal medicine and infectious diseases, and has practiced medicine in Minnesota and North Dakota for over 30 years, most of which was at Sanford Health in Fargo. He received his medical degree from the University of North Dakota and internal medicine and infectious disease specialty training at the Universities of Nebraska and Minnesota. At Sanford, he served in previous roles as the chair of the Department of Infectious Diseases, the director of infection prevention, the director of clinical research, and the chief quality officer. Throughout his 25-plus years in North Dakota, he has held an academic appointment with the UND School of Medicine and Health Sciences, where he still teaches and is a professor in the Department of Internal Medicine. In 2013, he joined the faculty of NDSU to help develop an infectious disease epidemiology track in their new graduate program in public health. During his time there, he developed and directed the NDSU Center for Immunization Research and Education, which received over $8 million in grant funding in its first 10 years. He recently retired from NDSU in July of 2024, but remains on faculty as an emeritus professor. On a personal note, he is the immediate past president of the Fargo Guild of the Catholic Medical Association and has significant interest in the relationship between faith and medicine. Most importantly, he is married to Janine, who he met in medical school and with whom he shares 4 children and 3 grandchildren. It is my absolute pleasure to welcome Dr. Paul Carson to the podium.
All right. Good morning, everyone. It's a real pleasure for me to be here. Thank you for the introduction, Doctor. And this is, I think, the second time I've gotten to speak in this beautiful auditorium. I grew up in Bismarck, and driving up the hills of the bluffs this morning with the sunrise just reminded me how much I miss the beauty of this area and how I think North Dakota has the best sunrises and sunsets anywhere. And you get this like every day looking out over the river. So I want to talk to you today about the connection between religion, religious practice. In the past iterations of this talk, I would say spirituality, but I don't think that covers it quite right, and health. And something that I actually think precious few of us in healthcare know much, if anything, about. And when I started to look into this, and maybe at the time of the panel discussion, I can tell you how I came to start looking into this. I was really shocked at the body of literature that's out there on that, and something that I think we in healthcare, especially as Catholic or Christian practitioners, really need to know a lot more about. Now, what are social determinants of health? There are a number of different things that impact our health. There's a growing body of research that suggests that the factors sort of around us that aren't intrinsic to our genetic makeup or direct care that we receive may have an outsized and maybe the greatest impact on our health compared to these other factors. And these are things like education access and quality, healthcare access and quality, neighborhood and built environment, our economic stability, and at the bottom I would say social and community content. These have all been recognized to have pretty large impacts on the future of our health. What you won't hear talked about much in there is things like our religious community and religious support, even though that would fall at least under that social and community content. It's estimated that these social determinants of health may account for somewhere around 70 to 80% of our health outcomes. Now, what I want to do today, this is a little brief outline of what I want to try and accomplish in the next hour, is that I want to go over briefly some of the historical connection between religion's role in healthcare and background of some of the current issues. go over a few definitions which are important to try and lay out the groundwork of the research. And I want to spend a fair amount of time on the current research regarding this association between spirituality and health, and review some of the possible explanations for those connections. And then I want to finish with what I think are some of the implications for public health, which is the area I've been working in more recently, and clinical practice, which is probably most of the people here. So some of the historical connections. If you look at the Gospels, it's estimated up to a third maybe of the Gospels pertain to Jesus' healing ministry. It was an integral part of who he was and what he did. And that was carried on in his disciples, and it was carried on in the religious communities that came after him. And we can see that out of the early religious orders, the convents and the abbeys and so on, really was the birthplace of the hospice and modern hospital development and movements. And that was carried forth into the 19th and 20th centuries, where many of these orders of religious nuns brought their orders to our country and established many of the hospitals and healthcare systems that we have today. In fact, it's still estimated about a fifth of all hospitals in the United States are either existing or legacy Catholic hospitals, and a good portion of the other hospitals and health systems had other Christian origins and roots from other faith traditions. I highly encourage you, if you're a fan of Ken Burns' documentaries like I am, he did a great documentary on the Civil War, he's done a number of different ones. He has a documentary on the formation of the Mayo Clinic, and it's just a beautiful story where he talks about Mayo Sr. and then his two sons that developed the Mayo Clinic, but how integral the Franciscan nuns were there into the development of that clinic. And he pays great homage to, and appropriately acknowledges how the Mayo brothers said that they could have accomplished nothing without those Franciscan sisters. It's a really incredible story of, and the Mayos weren't Catholic, but they adored their Franciscan sister partners in the development of the Mayo Clinic. I encourage you to look that up sometime. If we look at modern healthcare now, I remember my chair of medicine when I was training in internal medicine said, you know, don't listen to all the naysayers about how medicine's going to the dogs and it's all going bad. You're going to live through the golden age of medicine. You're going to see amazing developments of technologies for the treatment, diagnosis, and management of diseases. And I think to a large extent he was right. It's just amazing what I've gotten to see over my 30-plus years in healthcare on what tools we now have available to diagnose and treat and manage disease. But I think we also can recognize that a lot of that has come at a cost, that medicine and healthcare feels very mechanized, compartmentalized, dehumanized. It's a little hidden fact that primary healthcare providers are known now to spend more time with the electronic medical record than they do face-to-face with the patient. It's our bane. And patients see this, they experience it. As I age, I'm becoming more and more of a patient and consumer of healthcare, and I've gotten to experience this more and more firsthand. Eric Cassell was an internist who went into public health. He was at Cornell. And I like this quote of his. He said, everyone has a transcendent dimension, a life of the spirit, the quality of being greater and more lasting than an individual life gives this aspect of the person its timeless dimension. The profession of medicine appears to ignore the human spirit. You know, Dr. Fernandez talked about the transcendent aspect of what the human being is. And I think Dr. Cassell is right on this. This is not something that modern healthcare pays much attention to. But we have a number of very important concerns that overlap between our spiritual self and what we deal with in healthcare. Loss, mortality, the idea of what is dignity, hope, isolation versus connection, existential meaning and purpose, closure and legacy, and what happens to me after I die. These are intimately intertwined with what we do in healthcare and what is in our concerns of our spiritual nature and spiritual life. Well, as I've alluded to, religion and spirituality have played a traditional role in the development of a lot of our healthcare institutions. And as I've alluded to, science and I would say the biomedical model have really largely supplanted and even I would say marginalized or ignored that relationship. you frequently hear faith is a personal matter. It's a private matter, something you do with yourself, your family, your pastor. But I think we have a reemerging and growing interest in seeing that play out differently. As I've said, modern healthcare is often seen as compartmentalized, dehumanizing, and there is this greater and greater sense of a quest for meaning and purpose and more holistic care. And an increased recognition now of what I want to go into shortly is the growing scientific evidence of the connection between our health and our spiritual nature. So to give a little background to this, just to get some of the landscape of religious belief in the United States. 2022 Gallup polled people in the United States and found that about 81% would say they believe in God in some form or another. About 72% considered religion of considerable importance in their lives. In older research, more patients than physicians believe in a higher being. So there's a bit of a disconnect, at least amongst physicians and healthcare professionals in that capacity, and our patients. Most patients regard their spiritual health as being important as their physical health, and many would say, and at the time of that study, it's a little bit older, would say they pray daily. Ill people want their spiritual needs met, lots of evidence on this, and yet spiritual needs are rarely ever discussed or met. For example, in one study, only 28% of cancer patients said that it was addressed in any way at all. This is another study from Pew here on belief in God, and it's a little bit different by race and ethnicity. So we should, I think, recognize that people of color tend to have higher percentages of belief in God than others. So you can see blacks, Latinos, substantially higher than Asians and whites. And so recognizing that there may be some differences culturally in our patient populations. American Indians weren't included in this survey, but I found some other research that kind of puts them sort of in between blacks and Latinos, so pretty high, which is important in our area where we take care of a lot of Native American patients. And I find this study interesting. This was a study of outpatients, so not as seriously ill, at 6 academic medical centers across 3 different states, asking about some of these questions. And they found that 2/3 of patients felt physicians at least should be aware of their spiritual beliefs. A third wanted to be asked about their religious beliefs during routine office visits. And then as you get up in higher levels of acuity, that desire increases substantially. So spiritual interaction is desired more. For example, 19% said they wish their physician would pray with them during office visits, about 19%. 29% during hospitalization, 50% in near-death scenarios. We can talk about praying with patients maybe in the panel discussion. It's a whole almost separate topic. But it's interesting to note the level of desire on our patients' part to have that kind of connection with their healthcare providers. This was a study that was done on intensive care unit healthcare workers. And they were about their attitudes about addressing spiritual concerns. So when you ask ICU attendings, ICU fellows, ICU nurses, ICU advanced practice providers, in the blue represents the percent that said they would agree that addressing spiritual concerns is important. So most of them would say, yeah, that's important for my ICU critical patients facing potential death. And then when they're asked, how often you do this, it's really low, like almost never done. The best there is the nurses. They usually do better at all this stuff, but they're only about 25%. So I want to move next into the link between religion and health and do a little deeper dive on the research. My background is in infectious disease, and I do a lot with epidemiologic research, so that's a lot of what I'm going to talk about next. And so first we have to start with a couple of definitions before we move right into the research. And the people who are theology majors here might take issue with this, but these are the definitions that are typically put in the research literature on this topic. So spirituality derives from the Latin word for breath. It has to do with intangible elements of utmost importance and related to a person's sense of reality. Transcendent meaning. Dr. Fernandez mentioned that in his talk. I think that's probably one of the key features, that it's what is beyond ourselves and our place or purpose in the universe. Religion, on the other hand, comes from the Latin meaning to bind fast. It's a particular expression of spiritual beliefs, usually involving a code of ethics, sacred texts, stories, doctrines, rituals, and practices, and a way of perceiving the world, usually most often in a community. And then religiosity is the level of involvement in religious practice. That's actually the measure that gets done most often in research, because the other stuff's kind of hard to measure. But you can measure, like, how often do you go to church, or how often do you go to Bible study, or how often are you involved in some form of religious practice. That's a little more objective. If you look at the research on this, it's really kind of exploded in the last couple of decades. This is PubMed listings for articles related to religion, spirituality, and health. Huge increase. Newsweek a number of years ago had a cover story on this: is religion good medicine? Why science is starting to believe. And now there are a number, this is just a partial listing of dedicated centers of research in major universities on spirituality and health. So Duke, Michigan, Harvard, George Washington, Berkeley all have dedicated centers to researching the issues around spirituality and health. Probably the godfather of this is Dr. Harold Koenig. He's at Duke. I had the pleasure of meeting him and going to one of his research seminars. He's just published just hundreds and hundreds of articles. He's written a textbook now in its third edition called the Oxford Handbook of Religion and Health, where he compiles really what's become a pretty vast growing body of literature exploring these connections. He's trained in both internal medicine and psychiatry. And I think the sort of inheritor of this is Dr. Tyler Vanderweel at Harvard. I'm kind of a fanboy of his. I follow all of his research. He's the lead investigator of something called the Human Flourishing Program, where they're doing research. They have a very interesting definition of, like, what is human flourishing, and he was Oxford trained, and he was brought there because he's a research methodologist. He brings an incredible degree of academic rigor to conducting research, and he's headed up this unit, and he's just put out just excellent study after study. It's probably no surprise to us here that he's a devout Catholic. So taking a review from Dr. Koenig up through 2010 of the research literature on this, I'll just give you a few snippets from that. Looking at coronary artery disease, hypertension, cerebrovascular disease, Alzheimer's disease and dementia, and cancer outcomes. Pretty much the majority of studies show a significant positive association in better outcomes, better health, better management of the disease in people who are more engaged in a religious community or religious practice. And the higher the quality of the studies, the stronger the association. Dr. Vanderweel now has started to pick up this research. Dr. Vanderweel has gotten attached to one of the best, what we call prospective cohort studies out there. Prospective cohort studies are sort of the best epidemiologic study tool we have, right under what we call randomized controlled trials. So randomized controlled trials are, we'd love to be able to say, you 10,000 people go be religious and practice religion, and you 10,000 don't be religious and don't practice religion, and let's see how you do. Of course, we can't do that. So we have to rely on natural experiments. And the Nurses' Health Study has followed almost 80,000 nurses for, I think they're probably out to about 3 decades now. They have a follow-up study called the GUT study, growing up to, I can't remember the TS is, but it's the children of these nurses. And so they've been following these families now for several decades. And you can do really good research on saying, what are the things that you do, how you act, how you live, what your baseline health is that predict what you're going to be like in 10, 15, 20, 30 years in your health. And he started to look at this group of this nurses study on a number of different outcomes. So this is one looking at cardiovascular disease and cancer outcomes. And what he found, and so this was mortality from cancer or cardiovascular disease. And he found significant reductions in the nurses who were religiously involved at the beginning of their study over time. And in fact, that equates to about a 21 to 41% reduction in mortality from those two specific health outcomes, from heart disease or cancer. It's remarkable, really remarkable. There's been studies on how well people manage their diabetes. One study of African American females with type 2 diabetes mellitus who were religious or practiced their faith regularly, have better coping skills, manage their disease better. Religious belief correlated strongly with better glycemic control. And interestingly, in one of the studies where these women struggled with religion, and this has come up in other studies, where God has abandoned me, God doesn't love me, I'm angry at God, they do substantially worse. Their health outcomes are substantially worse. Dr. Koenig reviewed the literature in mental health outcomes up through 2010 and found people who are engaged in religious community and religious practice are much more likely to be happy overall, much lower rates of depression. In another study that I find fascinating, and this was, this might be the Michigan group, if I remember right. They looked at adult children of parents with major depression. So these are kids that have a strong genetic predisposition to being depressed as they grow up. And they found that if that family and those children were involved in religious practice and religious community on a regular basis, they had a 90% less likelihood of suffering from depression than their non-religious counterparts of children from depressed parents. And then in another study, they followed them up, and they did these very high-tech MRI scans, functional MRI scans of the brain, and they found that these children of adult parents with depression who were scanned over time had thicker areas of the cortex of their brain in several key areas that are involved with emotion and mental health. So there's actually anatomic changes over time. They also found in other studies that if depressed, they're more likely to remit and remit faster. And other studies have shown substantially less anxiety, better marital stability, less delinquency, and overcoming substance abuse. Another one of these prospective cohort studies that's, this is funded by the NIH. It's a long-standing study on a number of different risk factors or predictors of health or disease as you go through time, called the NHANES study. It's now in its third iteration. Looked at religious attendance over an 18-year follow-up and found 94% reduced risk of suicide in those who are regularly engaged in religious practice on univariate analysis when they apply a much more rigorous methodology to try and knock out confounding variables. It still stood up as a 68% reduction. There's, maybe there's some psychiatrists here. I don't think there's precious few health interventions we can do that have that large a reduction in suicide risk in people who suffer from depression. Dr. Vanderwill, fanboy here again, he did one of these large prospective cohort studies, again on the nurses' health study, and they looked at suicide risk here on the nurses that never attended any religious community or practice, less than once a week, or more than once a week. And again, 84% reduction in suicide risk over time in that nurses cohort study. And he's very fastidious about adjusting for confounding variables. That's why he was brought to Harvard. He brings a great degree of methodologic rigor. So adjusting for demographic covariates, lifestyle factors, medical history, depressive symptoms, social integration measures, et cetera. That relationship showed an 84% less likelihood of suicide. Another study that I find very interesting looked at pain control or pain management. And this was a group of researchers that I think they gathered up a bunch of college students. And they said, we're going to see how long you can hold your hand in this ice bath, which becomes quite painful after just a few seconds. And they had them do different types of things to help them ameliorate the pain or last longer. So they gave one group a secular meditation exercise, another group a relaxation training exercise, and then the third group they gave a spiritual meditation exercise. So the secular meditation group had to kind of try and be calm and say something to the effect like, I am peaceful, I am calm, I am peaceful, I am calm, but my hand hurts, I'm peaceful, I'm calm. The relaxation training is the ones, where you do the sort of biofeedback. You learn how to relax your muscles, move from your feet to your toes, up to your head, and so on. And then the third group, they had to do a spiritual meditation, which was God is merciful, God is love, or God brings me peace. And what they found was that the secular meditation and relaxation training groups, compared to a control group, could keep their hand in the ice bath a little bit longer, about 46 to almost 50 seconds. But the religious meditation group was able to almost double that, about 92 seconds. And they didn't pre-select these college students for their religious background. If they were opposed to doing the religious meditation, they allowed them sort of some pathways off of that, but almost none of them did that. So this was a random selection of these 3 different meditations. Then they repeated this study a little bit later in another group, added another meditation because they thought, well, maybe it's not the religious part of it, maybe it's getting me out of myself, and maybe I need to add a meditation where I'm thinking about something other than myself. And so I think they had what was called the spiritual meditation again. I can't quite read it from here. The secular meditation, intrinsic and extrinsic, and then relaxation. And so the extrinsic one was, the sky is blue, cotton is fluffy, to just get my mind out of myself onto something outside of myself. And they found each of those things could improve their ability to tolerate the pain. But you see the bar that shoots up the highest, again, is that religious or spiritual meditation. So they were able to repeat that with their group, and this was not college students. And then they said, let's apply this to a real-world scenario. And so they took a clinic of migraineurs, so people who suffer from chronic migraine headaches, and they had them do these different exercises. And here again, each of them would help, but the spiritual meditation was the most helpful. It was able to reduce their number of migraine headaches over the course of a month, substantially more than the other forms of meditation. And then they also looked at how often these migraineurs took their migraine medications to abort their migraine headaches, and they found that the bottom dark bar there was the spiritual meditation group was able to get by with a lot less medicine. All right, I want to move to mortality. We call all-cause mortality kind of the big kahuna of epidemiologic research, so it's like one of the best outcomes to measure. I could go into that more in the discussion why, but it's one that we look for a lot in high-quality studies. So let's look at mortality outcomes. So some of the earlier research on this was U.S. life expectancy. This is, again, another prospective cohort study looking at whites and blacks versus never going to any kind of religious attendance or community once a week or more than once a week. And you can see substantially higher average age at death in those that attend religious practices on a regular basis. That translated into about an average of 7 years longer life for whites and 14 added years of life expectancy for blacks. It was remarkable. And this, again, tried to adjust for a number of baseline factors of health and tried to match people to be apples and apples. Koenig in 2010, again, reviewed this literature, found at least 121 studies at that time. The vast majority of these found a significant positive association of lowered mortality or increased life expectancy in people who were engaged in religious community and practice. An average of about a 37% mortality reduction. Tyler Vanderweel again, Dr. Vanderweel, got a hold of another big long-term prospective cohort. It's called the Black Women's Health Study, about 36,000 African-American women. And again, found, using it as a baseline as sort of a relative decrease here of going, less than or equal to once a month, 2 to 3 times a month, or greater than once a week, adjusted for just about every conceivable confounding variable you might say would, is a different reason for them to have this lowered mortality, and found a 36% reduction in mortality in this group over time. In that Nurses' Health study, looked at the same thing, found a 33% reduction if these nurses at the start of the study said they were regularly going to church or religious practice. If they maintained going to church or in their religious community or practice, that was a further added down to a 50% reduction in mortality over time. So if they maintained it. So they had a 33% reduction if they were just doing it at the beginning of the study. And then it was even additive if they were regularly practicing that over time. Think about that in contrast to some of our main interventions to try and improve your health, like lowering your LDL cholesterol or bringing your blood pressure under control. The all-cause mortality reductions for those things are about 9% if I go on a statin to lower your LDL to prevent, cardiovascular disease, or about a 24% reduction if I control your blood pressure with your hypertension. So this kind of pales in comparison to some of our best primary care interventions that we have. If you kind of stack this up, you can kind of compare that regular religious practice is about as good as being really fastidious in how you eat and exercise on a daily basis, or the difference between like heavy smokers and non-smokers. I mean, these are big differences. Dr. Vanderwill updated this research just a couple years ago in an article in the Journal of the American Medical Association. They reviewed almost 9,000 articles, plucked out 371 that they thought were really well done, had high quality, methodologic rigor, and then convened what's called a Delphi panel, which is a team of experts to review this and make recommendations based on that literature. And what they concluded was they came out with 8 statements with strong evidence quality regarding the association of frequent service attendance and health outcomes. Lowered mortality, a dose response association with attendance. We look in epidemiologic research for a dose response because that is more likely to suggest it's causal. If you see, because you can have serendipitous confounding variables that might be the reason, but if you see a dose response, it's more likely to be the real thing. Less use of smoking, alcohol, marijuana, illicit drug use, better measures of quality of life and life satisfaction, better mental health, fewer depressive symptoms, fewer suicidal behaviors, and in adolescence, less risky sexual behaviors, less smoking, reduced alcohol, marijuana, illicit drug use. Then they came out with another 8 statements with strong evidence quality regarding spirituality and serious illness. Noting, again, what I kind of alluded to earlier, spirituality is important to most patients with serious illness, 71 and 99%. Spiritual needs are common in that setting. Spiritual care is frequently desired. Spirituality can influence medical decision-making. Provision of spiritual care is associated with better end-of-life outcomes, but it's almost never addressed, or it's frequently not addressed. And spiritual care is rarely often, and unaddressed spiritual needs are associated with poor patient quality of life. Now, how do we explain this? I think it depends on what lens you, or what worldview you have, or how you look at the world. So if we look at it through the lens of faith, I think this probably makes sense to us, right? I quote Will Herberg. He was an American Jewish writer, sociologist, and intellectual. He said, "Man is homo religiosus, by nature religious. As much as he needs food to eat or air to breathe, he needs a faith for living." Blaise Pascal, I like his quote. You could take St. Augustine's that's similar to this. Pascal said, "What else does this craving and this helplessness proclaim but that there was once in man a true happiness of which all that now remains is the empty print and trace? This he tries to fill in vain with everything around him, seeking in things that are not there the help he cannot find in those that are, though none can help, since this infinite abyss can be filled only with an infinite and immutable object, in other words, by God himself." He's often paraphrased to say, there's a God-shaped hole in the heart of every person. And St. Augustine said something similar with, "Our hearts are restless until they rest in thee." So it stands to reason that if we're made by and for God, that if we're sort of living in that way, we're likely to flourish better, or likely to do better. But you don't need to invoke the lens of faith. I pull here 2 atheist, excellent scientists and researchers. One is Dr. Stephen Jay Gould. He's a Harvard evolutionary biologist. Another person is Jonathan Haidt. I highly recommend his books. He's a social psychologist, big fan of religion, even though he's an atheist himself. But they note that there's really solid explanations through natural selection theory or social solidarity theories on why religion might help bind communities together and help them do better and individuals to flourish in it. Now, there's been a lot of talk about and discussion in the research on this, on what are the potential mediators of this. So without implying like supernatural intervention by God to make you healthier because you're going to church regularly, that's something we can't really test scientifically, but there are a number of mediators that we can look at. And these are the ones that are typically talked about. I'm only going to touch on 4 on the left here, but all of these have had different research tools to try and measure things, like even trying to measure humility or gratitude or hopefulness, and then trying to apply these to say, what has the strongest associations. So first of all, healthy habits makes sense. If I don't smoke as much, drink too much, have promiscuous sex too much, or at all, I'm likely to do better. Healthy habits, Dr. Vanderwill has done some really nice research to try and tease out how much of that health benefit comes from just acting better with healthier behaviors. And it's about 25% of the effect can be explained by healthier behaviors or healthier habits. Social connections or social connectedness is one of the most talked about. And there's a great body of literature that suggests that the deeper and richer our social connections are in our family, in our friends, in the closeness of our relationships, the depth of our relationships, we do better. In a recent study, there was a look at lacking social connection as a predictor of mortality, kind of compared with regular smoking or excessive alcohol drinking or being physically inactive. And it was a stronger predictor of death over time than these other significant negative predictors of health. One study tried to tease out how much of this, religion part versus, social connections is there. It was an interesting study. They looked at the 6-month risk of death after open heart surgery. So, after you have open heart surgery, you may have problems, and mortality, it's a little bit of an older study, but mortality can be high. And they had a measure of like group participation or social connectedness, and they had another measure of importance of religion to you and religion in your life. They found that the group that had neither died a lot. So they were the highest risk group, almost 22% mortality. If you had, the next one from the right going to left, the next one, if you had good social connections, group participation as they called it, but not much in the way of religious affiliation, you definitely were better off, a much lower risk of dying of your heart attack. Similarly, if religion was really important to you and in practice, but you didn't have a really rich or extensive network of social relationships, you also benefited greatly. But if you had both, that was the lowest group of all. It was markedly less than all other groups. So there's something more than just the social connections there. Forgiveness, something that we are required to do as Christians. It's in Our Father. It's in many of Jesus' teachings. There's actually a growing body of literature on what forgiveness does to mental health. And so just a little summary of that: religious practice and belief are correlated strongly with the propensity to forgive. So people who are religious tend to be more forgiving. You don't have to be religious to be forgiving, but they tend to go hand in hand. People who are more forgiving suffer less depression, anxiety, problems managing their diabetes, and have higher quality of life measures. Vanderweel's group found that propensity to forgive was associated with lower depression, lowered anxiety, higher likelihood of multiple measures of psychosocial well-being in both the waves of the Nurses' Health Study and their children. And psychotherapeutic interventions are now increasingly being designed to promote forgiveness and have been shown to benefit particularly people with anxiety and depression. I think some powerful examples of this we've seen, in the news. Some of you may remember the very tragic case of this young man, Dylan Roof, who went into an African-American church, sat down while a bunch of them were having a Bible study. They welcomed him in, started asking him about himself, and within a few minutes he pulled out a gun and shot and killed 9 of them. At his trial, members of their family and members of that church showed up and said, "We forgive you." Can you imagine how powerful and how difficult that was? Similarly, this woman on the right, her son had gone into an Amish schoolroom and sent all the boys out. This is a horrible story, but tied up the girls and killed, I think it was a dozen of these schoolgirls before he killed himself. The Amish community reached out to her to tell her that they forgave her son and they welcomed her into their community in whatever way they could. Just extremely powerful. She was deeply moved. Last on the list that I want to try and go over is the idea of purpose and meaning. I love this quote by Mark Twain. He's a pithy guy. The 2 most important days in your life are the day you are born and the day you find out why. Now, when we think about purpose or meaning in life, we can have things like, my purpose is to raise my family, or my purpose is my job, or my purpose is to, have as happy a life as I can. But the major world religions offer much loftier notions of purpose that deal with the transcendent. Of course, in our faith, in Christianity, this purpose is union with the divine through faith in Christ. Islam, complete peace through true worship and submission to the one God. Judaism, fulfilling the mission God gave through his Torah, also called Tikkun Olam. Hinduism, Dharma, Artha, Karma, Moksha. Maybe you can tell me about those, Ashley. But some of these have to do with improving and doing better in your life to ultimately have union with the divine. This has actually been studied as well. So this was a study of retirees and kind of following them over time and how likely they were to die based on how much purpose or meaning they had in their life. And you can see on a point scale of life purpose from highest in the yellow to the lowest, that sort of black or dark blue, it was about a hazard ratio of 2.43, meaning if you were in that lowest group of purpose in your life, you were about 2.4 times more likely to be dead at the end of this, I think it was like 15 years or so, than the people who had more meaning or purpose in their life. That's, again, about as much as like being a heavy smoker versus a non-smoker. Now, this is a busy slide. I only show it to point out that people like Dr. Koenig and others have tried to develop a model of like what's going on here, why is this happening? And the model basically says, kind of on the left, if you've got an attachment to religion, to God, it tends to beget theological virtues, faith, hope, love. These often are manifested with religious community, religious practices, acts of love. These beget psychological virtues, is what he calls them, or traits: forgiveness, honesty, courage, self-discipline, altruism, humility, gratefulness, patience, dependability. Those beget positive emotions, social connections, tamp down negative emotions, and those theoretically may improve our immune system or our endocrine system or our cardiovascular system. Is there any evidence for this? There is actually some. So this was a study looking at serum interleukin-6 levels. This is a marker of inflammation in the body. And they found the never attenders to religious community or practice had substantially higher levels of interleukin-6 in their blood compared to those that go a couple times a year, a couple times a month, and those had more than those that go on a regular basis. So the regular churchgoers had much lower markers of one measure of inflammation, interleukin-6. University of Michigan group has one of those centers for spirituality, did a similar study. They looked actually, it's called the Landmark Study in Spirituality and Health. This is another one of these prospective cohort studies. They looked at 643 older adults that had some major life stressors, like death of a spouse, death in the family, loss of income, loss of home. So they got reason to be stressed. They found that those who had regular religious attendance had a 38% lower likelihood of having an elevated C-reactive protein, another measure of inflammation, another inflammation marker in the body. So this regular religious practice seemed to predict in this group of highly stressed people one marker of lowered marker of inflammation. And this remained after adjusting for age, gender, education, BMI, smoking, alcohol use, and social support. And interesting, it was only religious attendance that predicted the lower C-reactive protein. It was not how much they prayed privately. It wasn't religious meaning in their life, religious hope, general meaning, general hope, or sense of peace. There's something about getting your butt out of bed on a Sunday morning and going to church that probably attests a little more to what that faith means to you, I think. Another interesting study on this looked at telomere length. So telomeres are the end cap of DNA on our chromosomes that are responsible for helping our chromosomes divide and mitosis for cell division. The longer the telomere, the more life that cell has. The shorter the telomere, the sooner that cell is going to die. They looked at telomere length in people's cells based on religiosity. And it turns out that if you're more religious, you got longer telomeres than your not less religious or irreligious counterparts. And again, judging for a number of other things that might explain that. There's now 2 or 3 studies showing this. So there's all these different potential mediating factors to how religion and religious practice may be improving our health. And connectedness, purpose, forgiveness, gratitude, healthy habits, hope, etc. And again, you don't have to be religious to have these. And I'm sure I give this talk in secular audiences, and you can imagine how this sort of lands on a secular audience. And I said, I'm sure you can think of your uncle who's really religious and is kind of a nasty person and not very forgiving and not very grateful or whatever. But the truth of the matter is these things tend to get bundled together pretty well in people who are regularly engaged in religious practice. And there's a number of studies that show this, that that religious practice tends to correlate strongly. And here's a list of the different studies and the positive associations between these different traits. I would be remiss if I didn't mention that there are some negative correlates with religion and health. So there's something called extrinsic religiosity. So if I'm religious, but it's mainly because it's expedient for me socially to do that, I'd feel, ostracized at my work or my, family or whatever if I didn't go. That actually doesn't correlate very well with health at all, maybe even a negative. People who say I'm spiritual but not religious, we hear that a lot. Now I'm going to get a little more of that into a second. It's actually a negative correlate of health. Those people do not fare very well. Spiritual struggle, people who feel abandoned by God, not loved by God, angry at God, tend to have much worse health outcomes. Some of the more fundamentalist religions and some mental health measures. So people who are brought up in very, very strict fundamentalist religious sects may have some negative mental health measures. Obviously, the religions that eschew health care, like I only rely on faith healing or prayer, I don't go to the doctor, I don't believe in insulin, I don't believe in, other things, tend to do worse. Religious minorities. So if you're, a Christian in Iraq, you're going to have a tougher time, and your health may take a toll. So if you're really in a minority setting where you may be persecuted for your faith, that can correlate negatively with health. And there are some associations with LGBTQ and past association with some religious groups. Interestingly, though, there's a body of literature showing that gay people who are regularly involved in religious practice tend to do much better than their a-religious counterparts. So what are the implications of this? So I think we can look at this from a public health perspective, and we can look at it from us being clinicians. From the public health perspective, I think we need to recognize, Dr. Fernandez alluded to this a little bit, is what they call the rise of the nuns. These are people that on surveys say, I have no religious affiliation. So that's rising substantially in the last decade, especially in the young people. So that's the top bar there, line is the 18 to 34-year-old group. So you've got almost 45% of people in that young age group saying, I have no religious affiliation. We see this in surveys of kids after they leave the home, even raised in a Catholic home. There's only some maybe 15-20% that are still practicing their faith a few years after they leave home. But don't take that at its face value. And I love Monsignor Shea's book, From Christendom to Apostolic Mission. I think he nailed what I think some of the research literature is suggesting. So this is a study looking at sort of drilling down a little deeper at the beliefs of those who say they have no religious affiliation or nothing in particular. So, people say I have no particular religious faith. When they're asked actually about belief in a higher power or a spiritual force, it's up to 90% have some sort of belief there. So it's not being replaced with a sort of cold, materialist, atheist, naturalist view of the world. It's a squishy, fluffy, what I call sort of Star Wars theology. The force is out there. Similarly, this is religiously unaffiliated, net belief, God and higher power, 72%. Agnostic, 67% have some sort of belief in something other than a materialist view of the world. Even atheists, some people say, I don't believe in God. 18% will say, yeah, maybe there's something else there. One of my former colleagues, Dr. Clay Rutledge, he's a social psychologist. He was at NDSU. Now he's gone on to bigger and better things. He was sort of the rock star of NDSU. He was always on CNN, being quoted in the Wall Street Journal and all that. He's done a number of interesting studies and research on spirituality and belief in the supernatural. And he notes, as we all have observed, that there's a steady decline in Orthodox beliefs, Orthodox religions, the mainline religious faiths. But again, that's not being replaced by sort of a cold, materialist, naturalist, atheist worldview. It's being increasingly replaced by belief in UFOs, the paranormal, ghosts, astrology. I have Yoda down at the bottom. You know, if the force is out there, there's some kind of force. But Dr. Rutledge, I think, appropriately notes in his research, in his book, The Supernatural Death, Meaning, and the Power of the Invisible World, he says it isn't enough to make life longer, easier, or even more pleasurable. People need to feel that they matter, that they are meaningful members of a meaningful social world. Not all beliefs in the supernatural or paranormal help to fulfill this need equally. He notes that what's being replaced really is not as good for us. The Surgeon General released a report last year on our epidemic of loneliness and isolation. It's really a major problem. In there, they cite all these studies that we don't hang out together anymore. We don't get together with our friends. We don't go on dates. We don't socialize nearly as much as we did 1 to 2 decades ago. We are connected to our devices in a virtual world much more than the real world. And we see this maybe relating in ways to the increased number of deaths of despair, suicide, drug use, et cetera. Dr. Vanderweel in the Journal of the American Medical Association of Psychiatry notes that this increase in suicide that's been seen over the last decade or two, he thinks may be significantly related to the loss of the protective effect of regular participation in mainline religious community. He estimates that nearly 40% of the recent increases in suicide rates could be attributed to that decline in religious service attendance that confers this very robust observed protective effect. So what can we do about this from a public health perspective? Dr. Ullman teaches a class at Berkeley on spirituality and health. He's written a book called Why Religion and Spirituality Matter for Public Health. He puts out a few recommendations. One is he says, stop ignoring this elephant in the room. This is a big deal. It's a big predictor of health, and we just seem to do nothing about it or don't pay any attention or don't know anything about it. He recommends the fostering of public health and faith community collaborations, developing educational materials, kind of like we're doing here, and curricula for teaching in the health professions. I started with a 2-hour lecture up at the med school. It's a little bit of a chore to get it in there, but now it's in there. More longitudinal studies that better assess the mediating factors. And he would like to see, and others, more studies from non-Abrahamic faith traditions in non-Western countries, and maybe even doing comparative studies. Are all religions equal? Or are there differences? There are a number of good books out there that are being used in public health and medical school curricula that you should be aware of. And then Dr. Vanderweel, in that same seminal study, put out their recommendations from this Delphi group. They said that we should be have increased awareness among health professionals of this evidence for protective health associations and spiritual community. We need to incorporate patient-centered and evidence-based approaches regarding these associations to gain those better health outcomes. Recognize spirituality as a social factor associated with health and research, community assessments, and program implementation. And then they gave a separate set of recommendations for medical care. Incorporate spiritual care into the care of patients with serious illness. I think we could extend that to any patient, but especially for serious illness where it's really desired. Incorporating spiritual care education and training of interdisciplinary teams caring for patients with serious illness. And including specialty practitioners of spiritual care and care of patients. Consulting our chaplains and using our chaplains. And they should be considered as part of the healthcare team. How should this affect my medical practice or my clinical practice? All healthcare workers, no matter what your beliefs are, need to recognize that the majority of our patients have a spiritual life that they want to be addressed, and integrate that into the way we manage and treat them. Take a spiritual history. It should be a regular part of our social history, and we don't do it. Probe the connections with significant social history. It's a very important determinant of social determinant of health. And maybe at the panel I can share with you some of the stories in my own practice, how that's played out. Ask if the patient would like involvement of their clergy or hospital chaplain. Encourage your patient to engage their spiritual resources in the management of their illness, including faith community, spiritual meditation, and prayer. This slide is, again, what I kind of talk to a secular audience. I think we can go a lot further than this. I think this should be a really important part of our management. We can't prescribe religion, right? We can't prescribe faith, but we should be probing what's important to people and what maybe faith traditions they have. And if it's sort of fallen away or weak, encouraging them to maybe re-engage that or re-look at it and how that may be a very positive thing for them in a number of ways. Taking a spiritual history, this is one secular tool that's out there, but I think it's a decent one. It's called FICA tool, F-I-C-A, faith and belief, importance, community, and addressing and care. Faith and belief, do you have spiritual beliefs that help you cope with stress? If the patient responds no, considering asking them what gives your life meaning. Importance, have your beliefs influenced how you take care of yourself in this illness? Community, are you a part of a spiritual or religious community? Is this of support to you, and how? And maybe if they've fallen away from it, maybe encouraging them to get back into it. How would you like me to address these issues in your healthcare? Inviting that question. So as I said, it's inappropriate to prescribe religion, and we aren't religious so that we get healthier, right? That's not the purpose of religion, right? It's because we believe it's true. It's because we believe there is a God, that he made us. But we shouldn't dispense with or ignore or put aside this association. For patients who are non-spiritual, I think exploring and encouraging the development of mediating factors where appropriate. What gives you meaning? Can you improve your social connections? Can you forgive? You don't have to be religious to forgive. Can you be grateful? There's lots of stuff out there, TED Talks on gratitude that come from a very secular perspective. And lots of research supporting that. Humility, mindfulness. And caution, I would say, the doctor-patient relationship has a substantial power differential. And it's not the place, I don't think, to proselytize. We have to be mindful that they're not there to have us convert them or tell us what our religious beliefs are. But that shouldn't make us shy away from this. When I lectured at the medical school, I was surprised at the number of students, religious students, who came up to me afterwards and said they were just deathly afraid of bringing up anything religious with a patient, that they thought they would get fired for that. I was appalled because it's missing out on something extremely important. I'll finish with a quote from the godfather of internal medicine, Sir William Osler. He said that nothing in life is more wonderful than faith, the one great moving force which we can neither weigh in the balance nor test in the crucible. All right, are we doing questions at the panel? Yeah, okay, so I'll stop there. Thank you for your time and attention.